Okay guys, we're going to get started. I'm going to call the meeting to order at 6:02. I'd like to start by asking everybody to please stand for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Item number 2, reading of the mission statement. Nick, please.
Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you, Nick. I'll take a motion to adopt the agenda.
So moved.
Support.
Motion by Megan, support by Lori. All in favor?
Aye.
Any opposed? Okay. Item number 4, hearing of the public. Ms. Oaks, please give us your name.
Alicia Oaks, parent and guardian. So I'm here today to tell you about something that happened. It's been a couple months now, but there was one board meeting canceled and I did not realize that the location had changed here for the last one, so I am here at the first one that I can make it to.
Which is my fault, sorry.
It's my daughter, who's 12, was suffering a mental health emergency. I took her to Henry Ford Macomb Hospital. The psychiatrist recommended inpatient treatment for her, and we sat there. I was told she was going to Kingswood Hospital, and then all of a sudden I was told that the New Oakland people who reviewed her chart thought she could do the face-to-face program. I'm sorry, Safe House. I'm going to tell you about the last time my daughter went to Safe House. She was there for numerous days. I want to say 8 days. She was discharged, and within hours we were back at the ER. Safe House did not do anything for her. I asked her what she did at Safe House. She watched movies that were above her age limit. She was watching NC-17 movies, and she is 12 years old. These are things that should not be happening to our children. So she came home having night terrors and different things. 3 ER trips later, she was put into Kingswood Hospital. And so when they said Safe House, I said, absolutely not. Look at her chart, look at her record, and see what happened the last time she went there. So the lawyer that I am started digging. New Oakland represents many of the services that are offered to our children when we take them to the ER for services. So why are they the ones making recommendations on where my kids should be? Because I can tell you the last 3 hospital trips that I've had between my daughter and my son, every single time a New Oakland program was recommended for them. Not what the psychiatrist recommended, not what my kids' team who comes into my house and knows what I deal with on a daily basis is recommending. And I truly think it's a conflict of interest. Before New Oakland took over this, it was the mobile crisis unit that was going out to do these assessments. What I have since learned is that if I take my kid out of the county to an ER, it's a mobile crisis unit that will assess them. I don't have to worry about New Oakland. But why should I have to drive 20 minutes further to get her care when we're in a crisis to avoid the conflict of interest that is clearly here? And so that is why I'm coming to talk to you, because I think it's something that this board should be aware of. And I do think it's something that needs to be looked into, because an overwhelming majority of the time, even though my child psychiatrist or their team and different people disagree with this, they're recommending these lower programs that are funded and provided by New Oakland, and I think it truly is something that needs to be looked at. I have a great case manager. I have an even more awesome person. If it wasn't for her, sometimes I don't know how I get through the week. I have a stressful job. I have stressful kids. It just kind of is what it is. But at this point, I just really wanted you guys to be aware of that, and I hope that
hire, round 2, in the amount of $54,975. This has been approved by legal. I'll take a motion.
So moved.
Support.
Motion by Donna, support by Lori. Tracy talks first, then we vote, right? I'm having a mental. Okay. Tracy, go ahead.
So I think we've talked about this a little bit, and Don, thank you, was at one of them, and Linda, thank you, got to participate in kind of the last, or part of the last of the graduation ceremony. So just as a summary, 12 individuals from the previous time, this is actually asking you to do 12 additional ones, beginning as soon as September. The previous one was 6 months, this will be 8 months. The reason why it's a little bit longer was the recommendation of that group, and they thought they needed a little bit more time to absorb the information, but it's a leadership development program in which now for 8 months, they are given an assigned mentor. The mentors do actually get mentor training also, and during that process over the 6 months, they learn some very specific leadership skills, one class. They then go back for that month and practice that leadership skill set. They then come back to the next class and kind of report out challenges. I'll give you an example. They talk about having really difficult conversations and delegation, right? So then they have to challenge themselves for the next month to go, am I properly delegating? And then they come back and talk about it, essentially. Then they have a big project, and that's where Donna and Linda got to participate in some of those, and we're very excited. I did not expect this, but I was just so impressed with the ideas and ways that we can improve our organization that the groups came up with. So our next step is to meet with those and now go, great, how can we implement these great ideas? So it's nice to get some new and fresh eyes on challenging situations. So again, the ask, I'm explaining the history, the ask is to do this again. Even though I say 12, we have a tiny bit of flexibility of like 12 to 14. People do have to apply. Their supervisor also has to be in support of them participating, and they have to commit to the full 8 months, and they aren't going to be able to come to the classes and that type of thing. So I would be happy to answer any questions, but that's essentially the ask.
Donna?
I'm wondering, is the people that have already gone through the program going to be the mentors, or is it going to be the same mentors that have already mentored? That's my first question. My second question is, who picks who's going to participate in the program?
Sure. So the first is we have not defined who's going to be the mentors organization in an effective manner. I mean, not that those couldn't be those. This year we thought, and we talked about this with the participants, is maybe developing a buddy system initially. So the person who is selected would have a mentor and a buddy from the class who just graduated, right? So then that way they could kind of follow along with them. And the mentor in this buddy system would be like lifelong. Like in other words, it's not just 8 months. It's supposed to develop a relationship that would ultimately be successful and supportive for that person over their lifetime of their career. The second question is, the previous time we actually did a couple things. If you notice, one, the person has to apply on their own, so obviously they have to be interested. Second is their supervisor also has to fill out an application, so their supervisor would have to be supportive of it. Second, we then had, last time, it was really Dave and myself initially looked at all of them, and then got other feedback from other leadership about kind of finalizing it. What's cool is we did actually have too many last time, so we were going to look at the ones that we were going to be like second and third kind of option. If they weren't able to participate, others, we would go back to start with those and ask if they wanted to participate in this round. So we already have a couple that we hope would be interested in participating again. So I don't know if that answers everything.
No, that does. Thank you.
Linda, you have a question?
I was able to attend, thanks for the invitation, and saw several presentations, and they were innovative, very professional. They have learned a lot from their mentors and from the training package, what they learned from the contract that we have. And what I heard them say was very encouraging to me, kind of on the heels of an employee survey, that that they said they really wanted to be a part of this organization. They felt, after having taken it, and that they felt that they did want to be leaders, and they did want careers, and so that was very encouraging. I would, you can't let that drop. That we all have done stuff, and it's like, ooh, and then, what they suggested doesn't get picked up or considered again or whatever. And the other thing is that, kind of like, I think you're familiar with Leadership Macomb, but they're a fellowship, so that somehow all the members, the teams, the classes can build on each other and have kind of a fellowship. This group did talk about wanting to continue to meet bi-monthly, I think is what they came up with. So I hope they get encouraged to do that. And like I said at the meeting, I'm glad you brought this to us, that the staff brought this to the board to offer to the employees. I think it's a benefit.
And they were continuing, and again, the next step is we're gonna look at implementing ideas, because they do agree with you, I wanna just have an idea and not the beginning and end of it. Hopefully that buddy system will continue that engagement.
Okay, any other, Bill?
Thanks, Dana. This says round 2. How many rounds do we plan to do?
We're on round 2, so.
2 of 2?
Yeah.
Okay.
This
I'm
is
just
round-
checking because I'm wondering how much more.
We don't have a specific, so this would be for the next year, so in other words, and you would probably take off December for obvious reasons.
Sure.
So in theory, we would do about 1 a year if it's continued. The reason why I said round 2 is I think it's open-ended in the way that the ultimate goal for the organization is exactly what Linda was kind of alluding to, is those were 12 people that now feel very invested in, and they now want to make a change in the culture for the organization. So you have 12 people kind of ambassadors out there. If we do another 12 and another 12 over time, right, as you know, the numbers can very quickly in an organization change, and kind of the culture can change by having more numbers with the same vision and the same positive direction. So that's the ultimate.
Gotcha. And then last question, what pot of money does this come out of?
It is used across the board. In other words, we have Medicaid, Medicare, and Finance can answer it. If I misspeak, Tony, please jump right in. But it is not specifically allocated towards one particular funding stream. We use it as administrative cost, which means it gets spread over multiple funding streams.
Thank you.
Any other questions for Tracy? Nick?
Just real quick, the contract requires that somebody be appointed as internal champion. Who's serving in that role? Just for my information.
Myself.
Yeah.
Yeah.
Any other questions? Okay, I have a motion and support. All in favor?
Aye.
Any opposed? Motion passes. Item 5B, request to approve Happy or Not contract renewal for $8,455.21.
So moved. Oh, sorry. I love it. That's why. Sorry.
Really quick, this has been approved by legal. Motion by Megan, support by Phil. Tracy?
Enthusiastically. You're happy. You're not, right? So just a friendly reminder, if you walk around the corner, you'll see a little device, just because it's convenient. It has green face, light green face, light pink face, red face. You also see them like at the airports and various places. We believe in continuous improvement, obviously, but one of the ways we try to get real time and continuous improvement is to have Happy or Not. Happy or Not is very simple. If you guys, when you walk out, please go ahead and click it so you can see the actual questions. But I'm happy or not, and then it asks for feedback. Why are you unhappy or why are you not? And we actually we provide you with the most typical reported concerns or what people like or don't like. You also have the ability to write whatever you want. There's a keypad if you so choose. It does also produce it in multiple languages, so you'll notice at the bottom of the screen it has a few little symbols for a little bit Spanish, Arabic, and Chinese. Don't quote me to that, but that's ones that are popping in my mind. So this is a renewal. It's rather inexpensive. This is for the whole year. What that means is we have 6 devices, just like the one that you see in the corner. We also, if you haven't noticed this, when you go to our website, it asks the same type of question. It pops up, so we have a website version. And then all of our staff, I don't know if you've ever paid attention, but right near their signatures, it says something to think of, words like, how did I do today? And then there is an option for a link, and the link will send them to that location's Happy or Not, and they ask the same questions. And obviously, when I started the statements, I talked about continuous improvement. This is one of our ways to get real-time feedback, where Tema today will talk about the provider survey, or we have the employees annual survey. Those are kind of once-a-year things. This is one of our mechanisms to continuously try to get information from the people we serve, but also our team members.
Go ahead, Linda.
No.
Has the data, I didn't see it, but that doesn't mean it didn't happen. Has the data from it been reported to us?
It has. In fact, I apologize. I thought there might have been some confusion on mine that Gail was going to be here and provide it. So, Sandy, it's not in the package?
No.
Okay.
There is.
So I will make sure, if that's okay, Linda, she actually has it. I've seen it. She just needs to give it to you, and it has the last year's data.
And you're happy with the, with the. what's
Yeah, and
before you.
it's really because it's such a real-time continuous. That's for $8,000. I mean, that's not a lot of money for considering the amount of data and feedback we get. Also, if this is helpful, in the workforce update that was sent out earlier today, you'll notice that one of the staff members in the Happy or Not got some really good feedback. So we reached out to her and said, hey, would you be okay if we shared this with others? So you'll see that as comment. So it's also a way to celebrate, right? Yeah.
And I like the, it's a feel good to pick a happy face. So there's a little.
Or not. Yeah.
Okay, thank you, Linda. Any other questions for Tracy? I have a motion and support. All in favor?
Aye.
Any opposed? Okay, item 5C, request to approve residential lease A. This has been approved by legal. Take a motion.
So moved.
Support.
Motion by Nick, support by, is that you, Megan?
It was.
Okay.
Just,
TJ, do you want to talk about this? You want to talk first or a question first?
Oh,
I don't
I
know.
don't.
I'd be happy to answer any questions again. I apologize, I left these leases sitting on my desk, but I know everything about them, so.
Do you want to look at mine?
My question is more general than.
Where's the first one? Go ahead, Nick.
Yeah, my question is, we've been moving toward implementing a new system, so we were doing shorter leases now. These are both 2-year leases.
That's correct.
Why are we running, I mean, and maybe it's a question of Tracy more than to you, DJ, is the transformation to a new system on hold, or going slower than we thought, or?
You know, the idea was to try to push our leases out to our provider network. In many of the cases, our provider network is opting to not take the leases over. That's the most seamless transition for the clients, so that they would not see any change. They stay in the same house, the provider simply takes the lease over, and we no longer claw back the money that we currently do to pay for the lease. A lot of our providers are opting out of that. They don't want to do it. They can't afford to do it. There's a host of things there that they say that they simply don't want to do. And we are in a position where we can't really have 5 or 6 people not with a place to live. So we're renewing the leases for a short term in hopes that our providers, the more this happens, the more they recognize that they either have to go out and find a home, or that they have to finally move their ball a little bit more to the side of looking more seriously at the lease. So that's the reason.
We have explored several different approaches to try to, because they're expensive. And we're not really paying them, but it's coming out of
Their SSI.
their SSIs or their Medicaid or their Social Security disability dollars that is flowing back and forth. And we've looked at ownership or leasehold held by the residents themselves, the guardians, the providers, and others. Are we exploring different options, or is it just this? Because I think I've been concerned, you've heard it before. I've been concerned since coming on this board with the amount of money going into leases to buy these homes for, a fraction of what we're paying in leases. And whether the leases are privately, or they decide not to buy it themselves, the residents could, the providers could, we can't, because the county won't allow it. But I would just, let me just say, I would urge you guys to continue to explore every option possible, because this is taking money out of services as far as I'm concerned.
Well, technically, the lease clawback is coming from the individual's SSI. If they're in a home that is too expensive for them to live in, correct me if I'm wrong, Tony, but that is picked up on general fund. If
Can't be used.
right, if it exceeds that. And I think there's only one or two cases that is the situation where it is. Folks,
But it's also expensive for the resident.
it is,
Because they're
well,
using up all their assets.
the provider, the way I understand it, the provider is allowed to collect a maximum amount from each individual of $1,056. Out of that $1,056, they have to pay for room and board, for food and housing. And quite often, you have a vacant bed, so they can't collect that money. And what we are starting to do a lot of is that individuals' SSI money is not collectible because the guardian is not coming forward with the money or who controls that money. And that makes it very difficult for the provider to be able to ensure they're going to get $1,056 for each individual that lives in that home. So there's problems on both sides. We recognize it. I would say that in my tenure, we've gone, I've said before, we've gone from 125 or 126 homes down to 60 homes. So we're moving in a positive direction, and that direction is accelerating. But there are certain circumstances that we are still negotiating leases for short term. We are looking at other options. We're always looking at other options. There's a couple of different creative thought ideas that are on the table, but we're searching. It's a difficult protocol.
And we do have it's on housing, like a little task force group of individuals, and we really are trying to make it as global. They're trying to address a very specific scenario as the immediate need. But I do agree with you, Nick, and I think that's why we brought to you that creative idea that didn't quite pan out, right? But we continue to do that. I know Lori has some good and a positive kind of ideas and things like that. So I do think we need to continue to explore, because this, even us moving into the providers, it doesn't fix it. It just slightly enhances it. Yeah, it's still the same problem, just the problem's in a different spot.
Right. You know, people, we have some homes that we're renting for $3,000 and $4,000 a month, and that's a very difficult situation. All of that money is going forward. The food stamps are involved in the equation as well. What makes sense is for a provider to find a home that is cheaper, and what that ultimately means is the south end of the county is weighted more heavily with individuals, which is also something that we would not like to see. So it's a multifaceted problem with
Well, ideally, the way to save money is to shift from a lease to a purchase. And we haven't been able to do that as an agency, but maybe we can talk offline, but maybe we can play with some ideas that would allow them, the residents, to have equity in that property rather than just. I'm thinking out loud here, and I'm not suggesting, we're not gonna do it now, I just wondered why we were going back to 2-year leases. You're saying that's still, we used to do 3-year leases.
we should do 5.
We used to do 5. So two is still a shorter period, so we're still looking at the issue. That's right.
That's right.
Yeah, I just want to read, when we tell the landlord in 2 years, we literally follow up with the statements. Provider, landlord, all yours, and review, delaying the inevitable. Because 2 years from now, we're going to have the same conversation. So your dilemma is not going away, we're just going more time
That's right.
and details to be worked out.
Unless the provider decides to do it.
And that's what we're encouraging as options also.
Plus 2 years, John inherits the problem.
That was the, yeah.
As for lease A and B, there's only A on the table. Because there are no issues with any of the homes. All of the issues have been addressed by the landlord and by the provider.
And that's for A and B.
A and B.
Any other questions for TJ? I have a motion and support. All in favor?
Aye.
Any opposed? Okay. Item 5B, request to approve residential lease B. This has been approved by legal. I'll take a motion.
So moved. Support.
Motion by Linda, support by Lori. TJ, you want to add anything? Okay. Any other questions? All in favor?
Aye.
Any opposed? Thank you, TJ. I'll hang out, because I think you're next. Item 6, receive and file. 6A, MCCMH West relocation update. I'll take a motion to receive and file.
So moved.
update as to where we were. For those that weren't here, we're trying to close this building and relocate into 2 other buildings. One's located about half a mile from here, and the other one is the 2nd floor of the administration building. So all of the programs in here will stay intact, but we will divide them into 2 separate locations. And I have, when I came to you last week or last month, I can't remember, I mentioned that we would be looking at roughly a $500,000 a month increase for rent, and then about a $500,000 one-time moving fee that covers electrical and cabling and furniture and
Can I just make sure, correction, 500,000 per year? Or
per
month?
year. Per year.
Okay, I just want to make sure
Sorry.
everybody heard it.
Per year. I think I made the same mistake last time. So
I know,
I have since sat down and negotiated with the brokers and the landlords, and this time they're a bit bloodied, and we have that number down below, safely say below $200,000. So we negotiated in a very positive direction for both of those. So that's what we look at. We still would ask for a one-time purchase for furniture, and those purchases would come before this board again if they exceed the limit. And then there was a couple of talking points that I would like to make. I'm trying to sell this, and there's a couple of points that I want to make to ensure that you understand why we're doing what we're doing. Customer service would relocate from here to our admin building, and there is some discussion about moving our our crisis call center, merging it with our customer service center, because our customer service center does so very well. To move those 2 together, and they would both be together at that facility. In doing that, we would free up some space at admin, which is we desperately need. So that is one reason for doing it. We would lose the unused, or we would give up the garage space, which is directly behind us, 6,000 square feet, which has nothing but old furniture in it right now. It's not used. We're paying for something that we don't really need, 6,000 square feet. At one time, we housed all clinical records back there and some surplus stuff, and it's all gone. We've gotten rid of it, disposed of it, shredded it, moved it off to Iron Mountain, and that 6,000 would translate into additional office space that we could get at another location. Certain design features that have been drawn into the new facilities would accommodate a better traffic flow and welcoming of consumers. Right now, we don't have that here. There's no real good traffic flow that presents itself as a front-facing agency for our clients. And in the design of the new building, I've managed to do that for both of these. Staff positioning to give supervision a much better accountability. Are in offices, you don't know if they're in, don't know if they're out. We would move to a different furniture style, and you would be able to kind of an open concept, if you will. Enhanced design to prevent the spread of bed bugs and related incidents using the different materials. So carpeting would go away, and we do vinyl plank flooring. New materials that are on the market that would help us combat some of that, because John and I deal a lot of that, a lot. So that's another reason. Relocation and office positioning would allow for better grouping of like staff. Right now we have some staff over here and some staff over here. We'd be able to bring all of those staff together. More reliable mechanical components. Both of the buildings are newer. All of the components, the elevator, the HVAC, plumbing, doors, specifically doors, are all much newer, and we would not have the expense in the new one that we currently have here. John spends a lot of time up on the roof here because the air conditioners are breaking down constantly. By adding training to the 2nd floor, we bring all administrative functions into a single location, which I think is key. We'd be purchasing used furniture, using the existing furniture that is still presentable. There's not much, but we would still use that. And then I also was able to negotiate garage space at the admin building, which would allow us to bring back all of our Iron Mountain that we currently have stored off-site, and we could begin the process of going through and shredding and moving and scanning that in. And currently, the bill I have for May was almost $6,000. So that was not rolled into the cost, but that is something that we could see a significant cost savings to be able to bring that back. And I negotiated that garage space at no additional cost. So there's some cost savings, I think. There's obviously some expenditures as well. I have one lease in hand. The other one is due probably by Monday or Tuesday of next week. I'm going to go one last round, probably not about numbers, but more about details and other aspects of terms. And then we are going to submit these to legal, and I hope to have them at program and budget for the August meeting, because if we do not start construction by September 1, we're going to be in a real position of not being able to get out of here at lease end, and we'll have to do a holdover here, and that's going to cost us more money. So I just wanted to give you a brief update as to where we're going, why we're going, and hopefully answer any questions, because once I bring those leases back to you, I'm hoping that we can move through and have a lot of things addressed that you may have concerns about now. So, and I'm happy to answer any questions about this if you'd like.
Anybody have any questions for TJ? Go ahead, Linda.
Lease versus purchase on furniture. A lot of people lease their furniture. Why did you select purchase?
Because it's used furniture. Leasing is not really an option. We purchased new furniture when we moved the admin building, and it was a bit of sticker shock. And that was the company that the county uses, and we got the best deal, and I still think that it was just, it bowled me over what new furniture cost. I recently bought 10 cubes used for a tenth of the cost of what I paid for it brand new. So I would move in that same direction, and they would look like brand new. So I would go in that same direction.
And then I went on the tour here with you last month, and I understand a lot of the points that you made about why to move from this building. One thing, I don't know if anybody else thinks this, but I don't get behind the scenes in a lot of office operations anymore. But when I walk into our administration building, I'm like, where are the people? We're paying for all this space, and I don't see any people. I don't see many people, and I do see more. But, so is it going to be the same? I thought that when people had days at home and in the field and whatever, they did hoteling, so they still looked like there were people there, that you didn't have all this wasted, I shouldn't say wasted, empty space. So, in your new configuration, will it be like that upstairs too? Is that,
So in administration,
are you buying more than we need?
there is desk share. We have desk share situations, and we have remote work situations. And when people come in, they're set up on different days. So it depends on what day you came in. You may not see as many people that are there. But almost every single desk is full almost every single day in the administration building.
With people in it?
Yeah.
That's at 8 o'clock morning meeting.
Do what?
At 8 o'clock in the morning meeting.
Oh, before they go out in the field.
Any other questions for TJ? I have a couple. When is the lease up here again?
January 23rd. And I'm hoping to have all of the moves completed by December 1st. That's a push, because as you know, December is tough for getting people to move or construction done or whatever it is. So I'm hoping by December 1st. That's a very lofty goal.
you talk a little bit about, staff safety and if you think the new configuration would enhance that?
It will, and I talked about that last time, and I'm sorry I didn't put it in the talking points tonight. But security is one of the drivers for this. With the concern that came up at North, we're trying to apply a higher level of security across all of our buildings. In this building, it's not that easy to do because of the way that it's laid out. At the admin building, it is much easier to do because of the access control and the way it's laid out. In both of the new buildings, security is the top concern.
Okay, thank you.
Well, and customer feel welcoming, so it's that fine balance somewhere, right? Where it's like, you walk in and you feel welcomed, but then staff feel safe
Right.
behind the door while still welcoming, right? So trying to balance those two.
This building is an industrial building, and I said it at the first meeting that I presented this. Don't be fooled by this room. This room was done after we moved in, and I had someone else build this room for a forum, for training and for forums like this. So this is the nicest room in the whole building. If you go through the rest of the building, it's block wall and stained carpet, and we get no participation from the current landlord that's here. So that's one of the drivers we're leading here as well. We want a building that more represents public agency.
Okay. Any other questions for TJ? All right, I have a motion and support. All in favor?
Aye.
Any opposed? Thanks, TJ.
Thank you.
Okay, item 6B, I'll take a motion to receive and file the CCBH 2024. This has been approved by legal.
So moved.
Support.
Is that you, Donna?
Yes.
Motion by Donna, support by Linda. Tracy?
So this was some very, very basic changes essentially, and I apologize, I'm not gonna be able to articulate them, but if you had a chance to review them, it did a decent job of explaining the differences, but I'm happy to answer any questions that you all might have.
Nick?
My question, these look like amendments to the contract. We usually approve those rather than receive and file.
Yeah, and they'll jump in and correct me or state or say and jump in and correct me, but the timing of these was not, they did not give us, basically they gave them to us and said, you have to give them, you have to give them. So a decision was to be made to put them as receive and file with, and of course they went through legal for approval. That's an accurate.
Yeah, which we've done several times in the past.
So they've already been signed, is what you're telling me?
Correct.
Okay. Any other questions? I have a motion and support. All in favor?
Aye.
Any opposed? Okay, item 6D, I'll take a motion to receive and file the QSA PIP work plan update. Oh, shoot, I didn't do C, I crossed it out, sorry, okay, let's go back. So I'll take a motion to receive and file item 6C, CBH 2024, this has been approved by legal.
So moved.
Support.
Motion by Antoinette, support by Lori. Tracy?
Very similar to notice, you just add a letter. Essentially, and Helen, you're welcome to jump in if I miss anything, but essentially it was very, very minor changes that were implemented. It was an amendment, and you're seeing it as receive and file for the same reasons we just mentioned. And of course, our goal is to always bring it to you way ahead of time. Every once in a while, there's ones that they don't give us a choice on.
Some of these are pushing out right at the end here because they have to, the next one work until we sign this one. That's sometimes why we get such a hard push from the state.
Any questions? Okay, I have a motion and support. All in favor?
Aye.
Any opposed? Okay, now we'll move on to item 6D. I'll take a motion to receive and file.
Support.
Motion by Linda, support by, is that Lori?
No.
Oh, and Megan, okay. Come on, you're up.
Good evening. So I'd like to take a step back to just remind you, back in February, our CH presented the quality assessment of the performance improvement plan. And This is a program that's required by the state of Michigan for our program, and it's also required that every quarter the board receives an update on pieces of this program. So today, I'm going to give updates on the provider satisfaction survey, and I'll also speak about the events data. So, the provider satisfaction survey went out to our entire network, and the collection period was from May 3rd through June 7th. The method of collection was through hard paper copies and also electronically mail count that was sent out to these providers. And we collected the data through Microsoft Forms. That's where you put in all your feedback. And we also received some hard copies as well and added to the forms. The tool was developed from inputs from the different departments. So the way we developed the questions was guidelines from how the state wanted things to be responded to. And then we went to each department that was impacted. And we said, does this really meet your needs? Like, if we ask this kind of questions to our providers, will they give you meaningful responses that we can use to improve on the program? So all of these departments were able to provide their input. And we break this, so we wanted them to, we sent it across all the service lines that we have in the program. So as you can see on the third slide, we have all the different services that responded to this survey, so we have the option to identify what service lines they're in. We also wanted to know who in the agency was completing this survey, because we didn't just want it to go to the executive leadership. We wanted to hear from individuals like quality folks, finance, direct staff, so it was announced that everyone has to participate, so that's why you see the breakdown. And then the next slide is the responses. So, like I mentioned, each division, the questions were specific to how their services are provided. And I also would like to mention that some of the challenges that the providers are having, these are actually chain effects of things that are coming up from the state. So if you have examples that happened just when we sent out these surveys, we received a request from the state and say, you have to give us this data. It was some kind of an audit data, and they only gave us this short video. And when they give this to us, we have to drop what we're doing and go to the providers and say, you have to drop what you're doing, you have to give us this data. Oftentimes, they don't understand that this is not us deciding to just ask them to do extra work. It's coming from the state. And when they don't understand this, they think that we are giving them extra work or unnecessary work. And then it also reflects on how they feel sometimes about what we do. Because I know some of them made comments that we should give them more time when they're requesting for data. But the difference is some of them know exactly when it's us because we work through a process with them and tell them this is going to come, this will come, and this has come. So they are prepared for when we are doing audits or when we're doing requests for data. But when we get requests from the state, it just comes and we say, give us this by this date. Sometimes it's giving you this is something we've never done before, and we're just doing it us. So across the state, we have been putting together a list and presenting to our CEOs and telling them these are some of the challenges that we're facing, and they are also taking it to the state to see how they can work with us to mitigate some of these challenges that we have. So sometimes you see they may not like something that are happening, not because of what we are doing as CMH. It's just an after effect from what we're being requested to do by the state. So these questions also came with an option to put comments. So then besides the data that you see here, we also have a few questions that we're asking. So the first question, an open-ended question, we ask them, what can CMH do differently to improve your experience and to help you to be more successful? So we have lots of feedback from this question, and I just highlighted a few. And just also that you know, all of this data was shared with all the different department heads. So for every department health head, their section was given to them and said, here is the feedback from the providers, what are you going to do about it? So right now, they are already looking at them and providing feedback and saying, yes, this I can fix, here's how I can adjust, or no, there's nothing I can do about it because this is a state requirement. So once I get all of this feedback, I'm going to take it back to the providers and say, yes, we listen to you, and here are the changes that we are going to make, and here are the ones that we absolutely cannot adjust because it's out of our hands. So that's the plan. So for that question, some of the things that they would like for us to do differently, they want us to improve our access, our focus system, which is our EMR, and they want us to make it in a way that we can easily exchange information between our EMR and provider EMR. So this has gone to our IT. They want to allow more time for audits and requests. Again, I just talked about this. This is a typical example of what happened to us back in June, right when they had this survey. So that really got us in that state. They want us to review the required number of trainings and the length of time that it takes. Some of the trainings that they mentioned, it's from the state. Like this is a requirement, the state wants this kind of trainings to be provided, and this is how long the trainings take. So some of them, they don't understand that it's coming from the state. So after we receive all of this feedback, we go back to them and explain to them exactly what's going on and why they see some of these requirements. Then they said team approach with more collaborative meetings. So we have started having meetings with them to talk to explain some of the things that we're doing or what's coming, and also to hear from them how we can also work with them to make them more successful. They're liking that, but they're asking for more. So we're working through that as well. They say it would be nice to see MCCMH staff, especially leadership, be more active in attending community events, provider network activities, and fundraising events, evenings included. So that's one leadership knows about it, and they took note of it. They want to give providers competitive rates, so they always complain and they're always comparing MCMH with Green and Oakland. So I get that all the time, and it also came up in this survey. And they also want us to keep a provider directory of the So those are the main things that we identified of what we can do to make it more successful. Then another question that was asked is, what do you like the most about MCCMH? Some of the areas that came very frequently that I wanted to highlight. One of the things that they said was that they like the interim CEO because she's responsive and respectful. They also like the fact that the BTPRC is available to answer questions and to meet the needs of the members very quickly, safely, and effectively. MCCMH makes good effort on this.
What is the BTC?
Oh, I'm so sorry. Sorry. Okay, I'm going to explain. This is the Behavioral Treatment Planning Review Committee. So if there's a very challenging individual that they need to put a behavior plan for that individual, it goes through a committee for approval, because they want to make sure that somebody's not just sitting in their corner and just implementing this kind of modalities to be implemented on an individual. It has to go through approval. And sometimes this needs to happen really fast. So we are very responsive in that when this comes up, we respond very quickly and they're happy about it.
And Tama did a great job. I just want to add that it really is for if somebody is required to be restricted or secluded in any way that is never allowed unless an emergency one time, and then they still have to go through this BTRP. It's a way to ensure that restrictions and seclusions are not inappropriately used or overused.
Right.
And they have to report it, which we'll talk about in a minute.
Yes. Thank you, Tracy. And then the other thing that you mentioned is that the quality and leading meetings are professional, organized, and the meetings that we have started to have with them frequently to understand the challenges and also address some of the areas that we're able to address. Great partnership, staff are knowledgeable, helpful, and prompt in their response. Helen is a wonderful ambassador for NCMH.
She tried.
She wrote it.
It wasn't a name on it, so she just
Yeah.
put it in there. I like that idea. That's awesome.
And I have to say those two comments, they didn't buy me lunch today. But those two comments for the two of them, it came up multiple times as like something I just wanted. The efforts in helping providers to recruit and retain staff by offering incentive pay is also one positive aspect. So the last slide on this one, they also highlighted some other staff in addition to Tracy and Helen. I just put them there, and I also shared this with their supervisors or their managers so they can give a shout out to those individuals. So any questions around the provider satisfaction survey?
Are you doing the last 2 pages?
Yes, so this first piece was just about
Okay,
the
sure.
provider
I have a question on
satisfaction
that.
survey. And then the second piece is about the event data. So every single incident that happens, we get incident reports. And this incident reports could either come through a fax line or it could go through our AMR system. And we have a staff in the quality department who reviews all of these incidents there. In a quarter, we have up to 1,400, 1,500 of them. They review every single one of them and put them in different categories. Because some of them are reportable to the state, so we have to provide reports to the state about these incidents and what we're doing about them. So when we get these incidents, we put them in different categories and we train them. We're looking at trends, what is very clear, what are we doing, which provider is the highest offender, and sometimes we will request for a root cause analysis, and this root cause analysis will be built by a committee. In addition to that, every sentinel event that we receive, we also review it to see what could have been done differently to mitigate that situation. So this, what you're seeing in front of you now is for Q1, quarter 1. We had 70 critical incidents. We had 81 risk events, 11 sentinel events, and 15 immediately reportable events. And then we also had other, these are incident reports that came in, but they did not fall under any of these categories, but they are reports that we also had to look into just to make sure that something is not worrying somebody or that we do not know. So that's why we track them and still put them on order. This is for Q1. And then for Q2, we had 66 critical incidents. We had 49 risk events, 8 sentinel events, and 6 immediately reportable events. Any questions?
Go ahead, Megan.
It's not a question, but I just have to say, this is so, exciting. You are so impressive. This is just absolutely incredible, and it's a testament to the entire group of people. This is best practice that I know we all come from different backgrounds, like our work and what we do and stuff like that. But I mean, having worked in the public sector, now working in the private sector, this is what we're trying so hard to do and just failing miserably at it. You guys are just an absolute leader in services, and just the way that I love the tracking of the events, and just that you have somebody touching each one. It's the best way to be. And I just have to say that. I'm sorry. Good job. You guys are incredible. Incredible.
Thank you, Megan. Thank you, Linda.
Between quarter 1 and quarter 2, it looks like your incidents are up, which is good. People are reporting stuff they know how and they're reporting. But the total incidents, but the critical ones are down. Is that just a fluke, or is that because this is being looked at? And you
Claire responds. So for the first question, we are closely tracking incidents that are not being reported because sometimes we are not the only ones. Maybe something can happen in a home, and then the CPRI goes in there and we find out that we did not receive an incident report. So we will go back to them, and then we have to put them on the corrective action plan. So right now, nobody wants to go through that. So they are being intentional about reporting stuff to us. So that's why we are capturing most of them.
Good result.
Nick?
Could you just give us a quick definition of each of these types of major events?
Can I give you the disclaimer that she will do an amazing job, but they're very confusing and they overlap a lot. Yeah, like
Okay,
what
maybe-
means-
or maybe
there's
you
a
could
whole
just
human being
give
that
that to
goes,
us and
what
we'll
is
get it
this?
later.
And literally lines it up.
Would you like me to put down like something documented?
I think it would be helpful
Yeah,
because it's
that
that
would be,
confusing.
that would be good. I'd like to know what the difference between a critical and so forth are and how they're defined. And you don't have to do it verbally, but if you could give it to us in a memo form, that would be helpful. Some sort of definition.
Absolutely. I can do that.
I'll try to write it in plain language.
Right.
Yeah, probably in English. Plain English.
I'll do my best.
Thank you.
And I'll send it to Sandy.
Anything else?
I wish to add.
Thank you.
Thank you.
Thank you.
So good.
Okay, so I have a motion to receive and file. All in favor?
Aye.
Any opposed? Okay. Item 7, resolutions. I don't think we have any. Item 8, other possible agenda items. 8A, interim CEO update.
I will be very, very quick. I was gonna give you a quick update on the state budget, so if it's helpful, CMHA did send out kind of a summary if you haven't checked it out, but on a high level, the things that are impactful for us, there is in the line item budget, which begins next fiscal year, for 5.4 million of, I don't wanna get the wording wrong, I wanna say it's retroactive payments from the $19 an hour for methadone. We don't know what that means. We don't know if that's us. We guesstimate it's the regions that did not choose because we did not have the proper documentation to impose those. But just to remind you, so if they give us the money to go back in time, they still have to give us something in writing from CMS saying that we are allowed to do that. So just know that we have the full intentions of implementing and if the money is available to any of the methadone providers, but we still have the glitch of every year they have to provide us documentation demonstrating directly from CMS that we're permitted legally to do that. And if it's just a friendly reminder, the reason why that matters to us is really the state of Michigan should not be setting rates in the legislature, right? They have the best intentions, but why that is a concern is because Medicare rates, just like any insurance rate, should be competitive and negotiable, right? Well, if the legislator who, and I mean this respectfully to the legislator, but they're setting a set rate, think of the state of Michigan, and this is common sense. What you pay for a home in the UP is very different than you pay for a home in Sterling Heights. That's true with everything that you do. So them setting a specific rate, again, with the best intentions, it creates a non-competitive definition. And again, $19 in the UP, I don't know, that might be, Helen would know, that might be an amazing rate. Maybe that's not an amazing rate. We don't know. Does that make sense? So it goes against the principles of the rules and regulations in our contract that we say we follow. So I just wanted to highlight that one as we'll see how that works out. We want to give you, I know we've been talking about, I won't give you too much detail today, but our CSU and our funding concerns, I mentioned that. Teen Wellness got 3.5 directly from the legislator to do those types of activities. Hagera got 2.4, and Common Ground got 1.7 million to do CSU-like activities. So I only draw your attention to that because the legislator appears to be open to that, so that is one of our, not our only, but one of our next, Helen and I's mission is to figure out a way, along with lots of cheering and direction from Phil and Nick, about how to try to get that, because that is our current next best bet to get the money needed to be able to move forward with our crisis services, or one of our crisis services, I should say. And I will leave the rest maybe until next time, or I will also add it as a link in the written board update, just to save us time, if that's okay. But I'm happy, of course, to answer any questions if you do have them.
I have a quick question. For the set rates you were talking about, do you know if MAC, Michigan Association of Counties, has stepped in and backed one way or the other? Because I have not.
That's a great question. I know I'm not aware of them stepping in specifically like they did for conflict free and saying, hey, we're against. Be true, because not all the regions are fighting this. There's a few of the regions, so it's my impression, and you correct, you tell me, but that they might step in if we had a bigger group of counties kind of sharing their concerns.
Well, they'll step in if we need them to step in.
Okay.
So if that's something that MAC needs to discuss, then I'm second vice president.
Okay, that would be great. I think we'd love to, at least at the minimum, share the information with you and like the materials and see what you think.
Yeah.
Yeah.
If you can send that to me.
For sure.
Don't send it to Macomb.
I'll just connect.
Can I add something real quick, Dana?
Of course.
Just a quick update on all those resolutions that we sent up to Lansing. We are getting some feedback. Tracy and I have been receiving some. Senator Nesbitt responded, and then we've had a couple of staff from the Macomb delegation contact us about the conflict-free resolution. And, some of them are having a difficult time understanding it. So Tracy sent me today some plain language, one pager and some information from the association that I've sent around as well. So as those come in, I'm just trying to distribute as much information to make it as simple as possible so they understand what we're talking about and what we're asking for. But we are getting some responses, which I think is a positive thing.
Okay, great, thanks, Phil. Anybody want to add anything else or any questions for Tracy? Okay, thanks, Tracy. Item 8B, reminder, we have a recipient rights advisory committee meeting Thursday, July 18th at 8 a.m. at the administration building. And we have a CMH full board meeting Wednesday, July 24th at 6 o'clock. That'll be here at the 15 Mile Road location. Item 9, provider comments. No? Okay, item 10, hearing of the public. Is there anyone in the public that would like to address this board? Seeing none, I'll move on to item 11, adjournment.
So moved.
Support.